Hi, this is Dr. Shirley, family physician with Kaveri Hospital, Chennai. New Year is round the corner and all of us are getting ready for all the New Year get-togethers. But also there's a lurking danger. We are all aware about the COVID-19 wave that has started off and the number of cases have been increasing. So everyone is very anxious to know, is it a good thing or not to get together on New Year? So there are a few things that we can talk and discuss which will give us some clarity about whether or not this should happen. So when we are talking about avoiding or reducing the transmission of any disease which can be transmitted through droplet infection, the most important thing to reduce transmission is wearing masks. So wearing masks should become mandatory at this point so that we can reduce the transmission. In certain cases, we would advise to have a N95 mask use. So this would be particularly for those who are traveling and those who are at a higher risk. So N95 masks and generally wearing masks is probably the first and most important step we can take to reduce the transmission during this time period. Next is to assess our risk. So if we are a person who is in any of the important categories which I am going to mention, we should try to avoid going for such gatherings. This includes people who are pregnant, people who have comorbidities, and younger age group people who have not received both doses of the COVID-19 vaccine. These are people who should refrain from going into these kind of gatherings where there are more than 10 people. So when we talk about gatherings, the best thing is to make sure that it is a small gathering with 10 or less than 10 members, well ventilated, preferably outdoors, and also ensure that the people who are attending these gatherings are vaccinated. If possible, we can also do a COVID testing. That is one step ahead to make sure that we reduce transmission. And most importantly, people who are symptomatic, that is having fever or running nose or cold or any of the symptomatic cases, should avoid from going for such get-togethers. We should keep these things in mind to make sure that we are healthy and ensure that our loved ones are also healthy. People who have aging or sick people at home, like their grandparents or their parents who may be sick or having comorbidities or on long-term medications, should also try their best not to expose themselves. And long story short, make sure we are wearing masks, make sure we are refraining from going for such things if we are in a high risk, and last but not the least, ensure to do the hand hygiene, which is basically making sure that you're washing your hands frequently, using hand sanitizer, and avoiding transmission to others. So wishing you all a very happy new year and a healthy new year. It is better to stay safe than sorry, and make sure that we all have a happy year forward. Thank you.